Yeah, welcome back to the case of the month, January 2018. It's a case I did together with Master Dental Technician Catherine Kramer, and I think she's done really beautiful work here. It's really a full mouth reconstruction, which we've really performed in 5 steps, so in 5 appointments, the patient was finished. That's the initial situation, an elderly lady around 66, 65 years old, and she originally had a removable denture in the upper and lower jaw, which she didn't take out anymore. That's why we have excessive tissue growth in the first quadrant, and massive decay, of course, and periodontal problems. She was scared of the dentist, as you can imagine, with this kind of situation, so we decided to do everything in one go with a general anesthetic. So this is, again, the initial situation, the charting: insufficient crowns, decay, periodontal problems, teeth to remove, and of course excessive tissue growth in the upper right quadrant, the first quadrant. So this is what we planned. We planned to place overall 4 implants, restore her with a shortened dental arch, and just do new crowns, and of course remove the excessive tissue growth, do an apical gill reposition flat in the front to restore the teeth really properly, and do that all with full ceramic. You can see here the positions of the implants to be planned. So overall 4 implants, or 5 implants, I'm sorry, 1 in the upper right, 2 in the upper left, 2 in the lower right. And of course an apical reposition flap, that means providing or performing a full thickness flap, and recontour the bone, and then place temporaries for 3 months to be sure that the tissue is in the right position. In the lower jaw as well, open periodontics, that means really clean it properly, and the lower left blue arrow indicates a small root rest, which we of course take out as well. Then we go right into the surgery. The surgery overall lasted 5 hours. First of all, we took away all the old restorations. Second, we cleaned. Then we raised the full thickness flap. Of course, the fillings have been done before in order not to provoke any bleeding and to place really proper fillings. We recontoured the bone, really cleaned the teeth properly, removed the excessive tissue growth in the upper jaw right, and placed overall 5 implants. So like I said, that overall took 5 hours, and in the end we placed the temporary, and you can see here the x-ray after we've placed the temporary. For the implant in position 2-5, we did an internal sinus lift with bovine bone material. 3 months later, we did the implant healing caps on top, and you can see the internal sinus lift worked very well. There's no periodontal issue anymore. The bone leveled out, so really a satisfying result for us and the patient, and so we can go on and restore. That's the x-ray then before placement of the crowns. No apical inflammations, all the implants are properly osseointegrated, and no periodontal issues. The bone is nice and straight, compact are seen, so no inflammations there, oral hygiene is perfect. So we then just go and place the crowns. And this is already the final situation. Maybe remember the situation, the initial situation, and I think with the exception of a few minor details, like the 1-2 with the cervical margin is a little bit too high up, and the length of the tooth 1-1 is actually a very beautiful work, and you can't really see that these are fake teeth. And the patient, of course, was very happy, and her oral hygiene is perfect, and she's not scared of the dentist anymore. So thank you very much for watching, and I wish you all a pleasant month in January 2018 and a good year.